Welcome to New London Hospital. I'm Elizabeth Durazio, and we're talking about one of the new programs that's been rolled out here, the Mobile Integrated Health Service that assists patients after they leave the ER, the hospital. This is a wonderful program, and you'll meet someone like Clay Odell. He's the resource paramedic here, and they're going to come to your home and follow up with you to make sure you're taking the right steps to recovery. Thank you for joining us, Clay.
Oh, absolutely.
So this program really helps people not relapse back into the hospital due to unforeseen circumstances such as medication interactions or perhaps tripping or falling in their house.
Exactly. One of the guiding principles that started this program here at New London is the fact that your healthcare provider, physician, nurse practitioner, PA, they get to know you in the office, in an examining room. They may get to know you in the hospital, but it's an artificial environment. And the fact of the matter is you spend most of your life at home, and your home environment can have a significant impact on your health that the provider will never necessarily know. Now, years ago, physicians would make house calls on a regular basis, and that just doesn't really happen anymore. But we have a team of providers here who are, trained healthcare professionals whose schedule on the in the EMS service is kind of flexible. Some days we have very busy days with 911, and then some days we virtually don't do any calls. So there's time in between the 911 calls where we can go to the patient's home, set that up ahead of time, and basically be the eyes, the ears of the physician, PA, NP, and give that information back to them to let them know.
And this is a very relaxing experience. It's not like you're rolling with the sirens blaring. The idea is they're going to come in and you're going to check to see, are we taking our medication the right way? Are we able to follow the instructions that we were given on our outtake? But also, when you're in the stress of the ER, the hospital, you always forget something. It's always like the moment you leave, you're like, I forgot to mention this. You'll be able to help follow up with that, or perhaps look at hazards around the house, particularly for elderly or older patients that they might not realize are a problem. Maybe there's a loose railing. Maybe they don't realize they don't have slip guards in their tub, things like that.
Yep, absolutely. And that's one of the major factors that we consider here at this particular program. Is one of the major things that we do is to follow up with patients when they're discharged from the hospital. So we have a patient who's spent a couple of days with us here. They've gotten better. They're a patient of a New London practice, so we interface with that practice. And then we'll set up, if they agree to it, we'll set up an opportunity for say myself, to go to their home and do a number of things. Number one, we check their hospital discharge instructions, because a lot of times they don't hear everything. They're focusing on getting home.
I don't either. I'm like, I need my own bed.
Yeah, absolutely. So they may miss things, and they may have questions that it's kind of too late. I'm already gone. Medications. We want to make sure that the medications that they actually are taking are the ones that we are aware of as healthcare providers here. If they're taking additional medications or they're not taking medications we think they are, then we need to be made aware of that, and that's part of what we do here, and then we'll feed that information back to the provider. Thirdly is that we look at fall hazards, like you already mentioned. So, patients been in the hospital, they're elderly, they're at a significant increased risk for falling, and the kind of devastating consequences that can happen, hip fractures, bleeding within the brain, things like that. So we want to try and help people avoid falls. So we'll go and we'll do a kind of an assessment of the house for fall hazards. See if there's things that they might trip on, like you mentioned, throw rugs.
Ceiling fans, the pedestal ceiling fans. Sometimes we have a space heater that we rolled out and we forget because it's not usually there. Things like that we just take for granted.
Yeah, absolutely. And we'll look at we'll try to give them some advice on how to make their home safer. Specifically, just awareness. Make them aware that they're at risk for a fall and that we want to avoid that. And if there's things that we find out that, say we want to recommend that a grab rail be put on the tub, and they don't necessarily have the financial resources to do that, we come back to the practice, and there's care management and there's social services that we can probably find out some way to get that for that particular patient.
It's really such a wonderful way of following up and realizing that New London Hospital is here to improve the quality of care, and not that we don't get good care when we come here, but you don't have to want to come here unnecessarily. That's the point.
Exactly. We want people to stay at home.
Well, I would like to thank Clay and all of the EMS personnel here at New London Hospital for what they do. And remember, if you do have the opportunity to use the Mobile Integrated Health Service in your home, please do. It really is a wonderful opportunity to make sure that we reduce the number of times you're readmitted to the hospital, and maybe they can find a couple things that you can tweak in your schedule around your home that can improve your quality of life. This is just another one of the ways that New London Hospital is keeping us healthy in the Lake Sunapee region.